We're going to set up an A-line here. What we need is a normal saline bag. We need our A-line tubing, the cord for the monitor, and a pressure bag. You want to open up your supplies. You have your white caps there. So we're going to open this up. And make sure you go through your tubing and make sure you don't have any knots. You want to check your connections now because sometimes they're loose in the bag. So now's the best time to do that. See, we're a little loose there. The next thing you want to do is spike your bag. And you want to make sure you take the air out of the bag. So we can burp it if we're in a hurry. And we can also put the spike in. And then just pull this blue thing here, and it will help take some of that air out before we turn it over. All right, so after we get the air out, almost, the fluid's coming down. Okay, we can hang it on the pole. And then I like to pull this pigtail, make sure the fluid comes all the way down to the end. Excuse me. Wait until you see liquid come out the other end. There it goes. All right, once I see the saline come out, I like to go and turn these white things down, flush it again, and make sure that the water comes out of the other ports. So once that happens, there we go. I feel like we flushed it all the way through. Now, a lot of people forget to do this. These caps right here, they're only on there because of the sterilization product. You really should take them off and replace them with the white caps. If respiratory is going to draw blood on the lower, they may ask for the cap to draw the blood. That's fine, but in the meantime, make sure you put those caps on. And again, just to be on the safe side, I like to flush it all the way through and make sure that the water comes out of each end. Very nice. Make sure they're back in neutral position, facing outwards. I check my connections. Now I'm going to put it in the bag, and then we want to make sure we get it up to the green. Okay, some people think this is the hardest part with the neutral, and then pump it up until you're all the way. And I like to go to the bottom of the green because a lot of times it does go a little lower after you get everything set up. So if you're having a problem with your A-line, the first thing you want to do is check your connections and to make sure that your pressure bag is where it's supposed to be. I've seen some people talk about a YouTube video where they use oxygen. You shouldn't do that to blow up your bag because it could burst the bag. So there it goes. Like I said, I like to go to the end of the green, and then we're set. We can put the cord into the red. Have it here when the doctor's ready, they can plug in. And then you just want to go to your monitor and make sure it says patient and then it's an art line. So that's what it says. So once it's plugged in, we can get a reading and then we can talk about zeroing the monitor.